Welcome, everyone. Thank you for joining us today. We will be doing a short coffee talk recording to show you about our Chief Workforce Officer Toolkit here at the STAR Center. So to start off, we want to show you just how do you find this toolkit and what's in it. So there's two ways to get to the toolkit. You can either go to the STAR Center website, and this is part of ACU, the Association of Clinicians for the Underserved. And the STAR Center stands for Solutions Training and Assistance for Recruitment and Retention. And on there, you can get free resources specifically focused on workforce recruitment and retention for health centers. And this is where our toolkit lives. You can also find the toolkit, as we did it in partnership with NAC, the National Association of Community Health Centers, under the Health Center Resource Clearinghouse. And it's fairly easy. This is healthcenterinfo.org. Our website at the STAR Center is chcworkforce.org. And what happens is, whichever way you get here, it's going to redirect you to the STAR Center, and you'll be able to see on here that there are 4 key areas to this toolkit. So this is really highlighting what is a Chief Workforce Officer and why it is such an important role in a health center. So as I mentioned, in the clearinghouse, you can just search the term Chief Workforce Officer. This will come up. If you click on it, it's going to redirect you back to the STAR Center. And of course, right now it's just taking a little bit of time, but basically, as you can see, there we go. It's going to redirect you right to that page. The same thing in the STAR Center. There is a search button right here. So you can click on that, type in Chief Workforce Officer, and it will be the same thing. So now let's go through the toolkit. The first part of the toolkit are the Cwo Core Competencies. Once you click on this, it is going to download a Word document, and this was done purposefully so that you can have it and you can use it for your needs. We had an advisory group that put together these core competencies of what it really means to be a Chief Workforce Officer. And as you can see, as you scroll down, it'll give you more information on what this role is. And then we have 3 domain areas. So there's a foundational competency, leadership domains, and technical, functional, and occupational domains. And all within those, there's tasks and skills that really are essential to ensure that a CWO is able to function at the top of their ability in a health center. So it's easy to utilize this toolkit. You're able to go through it. Everything here is laid out for you. And really, it is just to see for individuals who are CWOs in your health centers, or if you're planning to start a position like this, what is it that's needed? You can also utilize this for job descriptions. It has many different uses for it. So it's there, it's for you to use, and you're welcome to download it at any time. As you can see, we have each domain area, the specific domain under that, the skills and the tasks that fit that area, and that continues through all of those 3 core domains that I just mentioned. So going back to the toolkit, we also have a job description template. And once again, that was purposely done in a Word document. So once you click on it, the Word document is going to download. And this is for health centers to be able to use and modify when you're putting out a job announcement for a Chief Workforce Officer. We were very strategic in the way that we put this together. We worked with an advisory group, we worked with health centers, we worked with those competencies that I just talked about, but we also wanted to ensure that our job description, the qualifications, everything about it was through a diversity, equity, and inclusion lens. So as you'll see down here, we have an area that talks about the importance of DEI. So this is something that's very important to us. Everything that we developed, we wanted to make sure was also through that lens. And then just to wrap up, before I move on to the next part of this coffee talk recording, which is actually really exciting because we're going to be interviewing 2 individuals who are experts in this area. We also have a Venn diagram. Now, what the Venn diagram does is that it really describes what is a CWO versus a Chief Human Resources Officer, and where do they overlap? This is something that we've received a lot of questions about to really explain what are the differences and what are the similarities. So we just laid this out for you. It is a 1-page PDF document, very high level, just bullet points on what a CWO does, what a Chief Human Resource Officer does, and where they overlap in that workforce and personnel strategy. And then finally, the last part of the toolkit for you to use is podcast recording. So this is part of our STAR Center chats with workforce leaders. And we're really excited about this podcast recording. So again, you would click this link, it'll open up in another page, and it'll take you to our podcast page. Now we have 2 seasons of the podcast. The first one, which are episodes 1 through 5, is the CWO series. And then currently we're working on a COVID-19 series focused on workforce. The 2 individuals that we are going to be talking to you today, they were interviewed and they were great interviewees for this podcast. And you're welcome to listen to any episode. All you do, again, you click on it and it's going to open in Spotify, but we're across all different types of podcast platforms. So you just have to search our name, STAR Center Talks Workforce Success. And as you can see here, the first few sessions are all based on CWOs. I believe our first one was from, and I just want to get the description. It was Scott Owens, who we are going to talk to today. And our second episode, our second or third episode should be, oh, my apologies. The third episode is Kathy Brieger, who we are also going to be speaking with today. So that is just a very quick overview of what is in the toolkit. You can always reach out to us if you have more questions. So if you go back to the STAR Center, you select Contact Us. And then on here, you can just fill out this form, ask any questions that you have. That will go directly to me, and I can filter it to the appropriate parties to answer your questions. So I will now stop sharing so that we can talk with Scott and Kathy. So hello, everyone.
Hello.
So just really quickly, can you both introduce yourselves? So Kathy, if you want to get started, and then Scott.
So hello, everybody. My name is Kathy Brieger, and I've been working at Sun River Health for almost 35 years. I can't remember the total number of years. And right now, I'm the chief of the Planetree Institute, but also workforce development.
Wonderful. And Scott?
Hi, yeah. My name is Scott Owens. I'm the Chief Workforce Officer at Mountain Family Health Centers in Colorado, and I've been the I've been working for Mountain Family for almost 8 years now.
Wonderful. Well, welcome to both of you. Thank you for being here. And we just have a few questions, and they're really based on the feedback that we've heard from health centers regarding this role. So they're excited about the toolkit, but they really want to also know more information on how to implement a lot of this. So I just want to start off by asking, why is this role so important for health centers? Why is this something that leadership really needs to buy in and take into account as something that's fundamental to the work that health centers do? And I can again start with Kathy, and then we'll go to Scott. We'll just follow that.
Great. So, in my opinion, I think community health centers have it at one of their mission as being economic engines of the communities that they're in. And this means hiring people from the community to serve. And I know that this has been really important in Sun River Health. We've had people who were community health workers who became clinical assistants, or other folks who were, became WIC clerks. And we are able then to train and develop these folks beginning at that level. But they're also the higher level people who we can help to groom with either certifications and everything. But I do tie it with the mission of community health centers, helping the community members to really achieve all that they can achieve through the health center movement and through the health centers.
Thank you. And Scott?
Yeah, I think it serves an important representation role as well. One leader in our organization used to say that if you're not at the table, you must be on the menu, and that gives us kind of gives you some perspective on to have an HR workforce representation in the C-suite at the table really shows that you're advocating and you're centered on the workforce being one of the main strategic pillars of your overall workforce plan and your mission. And that's a good thing. So, and it also serves to help ensure that people have purpose, are provided purpose in their work environment. And we're developing programs and strategies around retention and around getting people where they want to be and moving them in the directions they want to go. And I think that's another important thing for the strategy piece. And it serves a great role in helping with objectivity across all teams in the organization. That's a big part of what human resource professionals have to do. And it's a skill that is learned through a lot of success and a lot of failure, is that objectivity piece. So when there are issues and when there are problems, that's a big part of, it's a great asset to have in an organization. It's somebody that can really see both sides of the coin.
Absolutely. Thank you. Yeah, here at ACU, we say how, workforce is a fuel for your health center. Without a workforce, the health center doesn't function. And really the CWO is that person that is able to have that complete strategic vision of, how to retain the workforce and everything that they need. So that also brings me to the second question, and really it'll be the wrap-up question, because it's something that we get all the time, which is, again, this is great. How do we fund it? And, we've talked about just simply the importance of needing to prioritize this role. So, we may not be able to say exactly like, here's the line item where you can do this, but, what would you say to health centers when they ask those questions?
No, we've learned that the STAR Center actually has a formula that John Snow John Snow Inc. has come up with. What's the cost of turnover rates? And I think that's very valuable, because as you look at, how do we fund this? Well, sometimes if you don't fund it, you're also having very high turnover rates, which costs the organization so much more. I would say that, one of the things that the health centers that are smaller may think and say, oh, these people are so big, there's no way we can come up with the same kind of staffing that they have. I would suggest starting small. We never, at the previously Hudson River Healthcare, before Sun River Health was renamed, we had a smaller department. We started with just a couple hundred employees, and over time we actually grew this idea of, how do we work with teams and actually staff themselves in designing career ladders? How do we help them look at what are some of the opportunities they'd like to build in an organized structure? So it doesn't have to be a full-time position, especially in a smaller health center. Starting small and building on that program. And I think, Scott, you mentioned making mistakes and then learning as you go. I think that's the way we do things, right? But having an approach that says, look, the most important piece of this work is to get the voices at the table of the people who you are trying to work with. Don't just have executives. Make sure you have, whether it's a medical assistant or an outreach worker, make sure they're at the table, and then listen to them, because they will be able to guide you with some of these things. So don't be overwhelmed with having a big position when you could start with a shared position and then build on that as you grow.
Absolutely.
Yeah, I would echo that in a lot of respects, Kathy. I think that, and I for one am a good test case on this, because I started out as a manager in HR, and the perception of human resources, even now, but definitely 8 years ago, and even when it first started, was administration, was personnel, paperwork behind the scenes. When there was a problem, let us know, but nothing really proactive. And I think as you learn and grow in the organization, you want to look at HR professionals not just as behind the scenes, but on the front lines, getting to know staff, getting to know all the people in the workforce, with a big push around equity, diversity, and inclusion is a big investment to be thinking about as we move through year over year. It's important to have professionals in place that can look at everything, get to know people, strategize with people, and get to know the leaders. So if you have a HR manager or generalist in place, start pushing them to getting to know the leaders a little bit, get them in some trainings, get them in the areas that are a little bit might be out of their comfort zone, but it's going to be important to getting them to a place where they can start strategizing, a little business acumen under their belt, and really have an impact and provide strong representation to the workforce. You may also want to consider, if you're getting any COVID relief funding, to maybe think about maybe some temp temp position that might be able to roll into the general funding of a position and see how it goes. You know, try a 6-month or a year-long, 2-year-long position that might and kind of work things that way. It could provide some good opportunity there.
Yeah, I think I would echo that, in that, you know, you're also working towards something. They also include people who are like the operations, people who are really have great skills. And I think, you know, we've identified some people who didn't have an HR background, but they were great with bringing people together, building skills, mentoring, coaching, and they may have redirected their career into another, you know, into HR and doing some of the more people-related tasks. So I think that, you know, being flexible is the name of the game. And I love this new money that's really directing us. This is an opportunity for many places to say, look, I think we could maybe test it out with a consultant, or maybe with a small part-time position, or like Scott said, a temporary position that leads to something full-time. There's a lot of opportunity. Now's the time to actually make this happen.
Absolutely. Thank you so much to both of you. Before I start wrapping up today, is there anything else that you would like to say or mention in regards to chief workforce officers or just workforce in general with health centers?
You know, I could add that I think when it comes down to my role, as I see my role, it narrows as the department's been built, and I've hired some staff of my own. It now becomes mostly around leadership consultations and leadership training and communication, and working with people on how to communicate better, and how to I guess recognize that there's dysfunction and try to resolve a lot of that dysfunction in the organization. And I think that's a good thing, and people appreciate that, because everyone advocates for their own department, ideally, right? Operations is going to advocate for ops, and finance is going to advocate for finance, and the HR gets to be in the middle going, how do we make this work for everybody? And CEOs really appreciate that they don't have to be that person necessarily all the time. So another thing to consider.
And I like the idea, you know, for me, the most meaningful part of this work is seeing someone join the organization that has really come in with not a lot of self-confidence, and who, through the work with either coaching by their supervisor or, you know, doing some programs where they have opportunities, becoming a full-fledged member. You know, I know we had this one staff member who was she was actually a front desk clerk, and she was very shy and not able to do any presentation, but she was excellent, not only with customer service. And that was 20 years ago. Today, she's one of our practice managers. She's done presentations for the board. She's one of our trainers. And I think, you know, that doesn't come without an intentional plan and an intentional work. And I think that that's also the role of a community, of someone who can work in this role as chief development officer. It really can happen, and you can change lives, which, you know, to me is the most rewarding thing in this work.
Thank you so much to both of you. And I agree with you on the, you know, how rewarding this work is. So thank you for speaking to me. So my name is Michelle Fernández Gabilondo. I am the Senior Training Specialist here at ACU with the STAR Center. Today we were talking with Kathy Brieger and Scott Owens. And as I mentioned, you can go to our website, chcworkforce.org, to access the toolkit. And then you can also contact us at info@chcworkforce.org. Thank you so much. Thank you so much to both of you for being here.
Bye-bye.
Thank you.